Can alternative treatments for ADHD or hyperactivity or learning disability be effective? Is it possible for one approach to be effective for all kinds of developmental disorders? Well, there is no cure. All the experts, all the diagnostic criteria clearly define that there is no cure for any of the developmental disorders. That includes ADHD, hyperactivity, poor impulse control, attention deficit, learning disability, autism, Asperger's. None of them has a cure. There is no effective treatment because there's no cure, and there cannot be an effective treatment if there's no cure. If there was an effective treatment, they would be cured. Now, why is there no cure? Well, developmental disorders are the result of the developmental process being blocked. The child's symptoms are signals that the process is blocked. Now, the professionals use these symptoms as a way to diagnose what the exact problem is, and then they apply approaches to try to fix the symptoms, but the symptoms are not the problem. A fever is a symptom of something else. The child has some kind of infection, so there's a fever. And so you use that as the fever as a symptom, as a signal to tell you, okay, there's something else wrong. Let's find out what's wrong. But the fever itself is not the problem. The something else is the problem, and you don't want to just treat the fever. You want to find out what the problem is. A fever is not a symptom of having a fever. A fever is a symptom of something else. The professionals are shooting at the wrong target. Symptoms are signals that the developmental process is stuck. Reducing symptoms does nothing to re-engage the stuck developmental process. An effective approach for developmental problems would be to re-engage that stuck developmental process and then encourage the process to catch up so that children mature and grow up just like all the other children their age. If you had a plumbing problem in your home where the water was not flowing properly, you would discover what was blocking the flow and remove the blockage. Then you would have the normal flow. You would not decide that the water will never flow properly, nor decide to permanently reduce your expectations for water in your home. Educational training programs try to teach unteachable children as much as possible so those children become adults with developmental problems. Behavioral training programs try to teach unteachable children as many coping skills as possible so those children can survive as adults with developmental problems. Medical treatment programs provide children with medicines to suppress the symptoms enough for the parents and teachers to tolerate the child's behavior so that children can learn as much as possible and grow up to be adults with developmental problems. The big picture, about 1 in 6 in the U.S. has some kind of developmental problem. About 1 in 7 has ADHD or learning disability. About 1 out of 100 has PDD. That's pervasive developmental disorder, autism, Asperger's, PDD not otherwise specified. There is no cure and there's no effective treatment. Something's wrong. What if developmental problems are not medical, psychological, behavioral, nor educational? What if it's something else? What if there's something you can do in your own family, your own home, which re-engages the stuck developmental process and encourages the developmental process to catch up? What if this something is not a treatment nor a cure, but is simply a cultural shift which gets your child back on track? Will you make a commitment to learn about this process and make a reasoned choice about doing this for your child's health and future? Hi, I'm Roger Bailey. Come by our site at getmychildbackontrack.com. Find out what this is all about. Find out if you would like to bring your child back on track.